Public-facing workers like private car hire drivers and private healthcare staff directly involved in COVID-19 operations will soon get better protection from abuse. They're among 30 new categories under an anti-harassment law for public service workers. Now, this kicks in next Wednesday. It's the first review of the legislation since it was introduced some 7 years ago. Deborah Wong with more.
Whether it's standing in line for longer than expected at a COVID-19 screening operation or getting turned away at vaccination centres, tensions can sometimes run high. Healthcare workers often bear the brunt of it. Of the new categories getting better protection under the law, more than 10 are in the health industry. 5 are specific to COVID-19 roles. It's not surprising why.
Singaporeans are rather fatigued, dealing with the pandemic. Some may have less patience and tend to throw out their expression of impatience with verbal abuse, sometimes harassment, sometimes violence.
Healthcare workers reported a 20% increase in cases of verbal or physical abuse from 2018 to 2020. Those who abuse, harass, or dox a public service worker on duty may be jailed up to a year or fined up to $5,000 or both. That's a stiffer punishment than if the victim is a non-public service worker.
These are corrective measures, but what we want to embark on as a union together with our employers and also the Ministry of Health is to ensure that the number of such cases can be prevented, respect our healthcare workers and provide them with that kind of dignity as a worker.
Against the backdrop of cases like these, private hire vehicle drivers will also be protected. Labour MP Yeo Wan Ling says the union for this group had engaged the Land Transport Authority on better protection. The move will make trips safer for both drivers and commuters. But she adds that it's also crucial that platform operators review guidelines to make it easier for drivers to report abuse. Other new categories include those in crisis response roles in airports and ports, as well as social workers working in crisis shelters and welfare homes.